Hello, Professor and fellow classmates. Um, Today I am reciting my PowerPoint for my research proposal, and it is on the risk of relapse for SUD with incarceration history versus SUD, the risk of relapse with SUD in the general population. A literature review. Um, In exploring the question, do individuals with SUD and incarceration history run the risk of relapse more than individuals with SUD in the general population? Research can show a clear need for treatment for SUD and incarceration history, and they are more likely to relapse than those with SUD in the general population. Mytel et al. Says over half of overdose deaths are from incarcerated individuals that meet the criteria of substance use disorder, putting them in a high risk category. Literature review continued. This research will show the relapse risk among those with SUD and incarceration history and those without incarceration history in the general population. It will fill the gap of the reason why those with SUD incarceration history risk of relapse is higher than those with SUD in the general population. It would also show how treatment programs can enhance the development of the programs to be structured towards those with SUD and incarceration history as well as SUD in the general population. In most treatment centers, there are little to no programs that address the criminal mindset. Williams and Chang says there is evidence that treatment is superior to no treatment, but insufficient evidence to compare the effectiveness of treatment types. How do those research questions. How do those with SUD and incarceration history become more at risk of relapse than those with SUD in the general population? Why is there less risk of relapse for those with SUD in the general population than those with SUD and incarceration history? I believe because there's uh, those with incarceration history are more at risk because there's they have more issues added to drug addiction, where maybe in the general population, if they've never been to jail, they don't have those issues. They may not have the issues of uh, not being employable or lower education, um, things of that nature. Uh, different factors affecting them, such as mindset, um, the mindset. Once when you start doing criminal activities, you get a certain mindset, as well as an addictive mind. So it's kind of like two areas that need to be addressed. Where I feel as though treatment centers kind of look over the criminal mindset and just focus on the addictive mind, which most people who has incarceration history where they have repetitiously been incarcerated, then they have another mindset as well that needs to be addressed. The study and design chosen and why. The research is a quasi experimental design with quantitative data. The variables to explore are the risk of relapse among SUD and incarceration and SUD in the general population. The formal scale used was a comprehensive assessment and treatment outcome research tool, which is a which is a questionnaire given before, during, and after treatment, along with a pre-test, post-test observations and interviews. It Also included a time series of 6 months to 12-month intervals and follow-ups of discharge after treatment. The reason I chose this design was to be able to learn why the risk of relapse is greater for incarceration history and SUD individuals and to seek out more research on what is being done about it in the treatment programs. For integration, the implications that this study could have upon the counseling field with integration of a biblical perspective could be how changing the mindset could help to lower the risk of relapse. A scripture that will represent the biblical integration would be, to me, would be Philippians 4, 8 and 9, which states, "Finally, brothers and sisters, whatever is true, whatever is noble, whatever is right, whatever is pure, whatever is lovely, whatever is admirable, if anything is excellent or praiseworthy, think about such things. Whatever you have learned or received or heard from me or seen in me, put it into practice, and the God of peace will be with you." Philippians 4, 8, 9, NIV, Bible, 1984. This is saying to me, what is in the mind is in the person. Change the mindset and you change the whole person. This gives hope for those with SUD and incarceration history that it is possible to learn how to think better by learning positive ways to think and do and be. In the counseling field, the focus should be geared toward all individuals to help them by finding and researching the root cause to relapse and not blanket the treatment as if individuals with SUD only fit one category. And here are my references.